welcome everybody. Thank you so much for joining us in our Reflective Practice Systems Leadership webinar this morning. I'm Sam, Comms Officer at Golden Key. We are recording, but I'm going to pass over now to our fabulous facilitator, Beth. Thank you very much, Beth.
Good morning, everybody. And welcome. I think it's our fourth system leadership webinar. Is that right, Sam? Yeah. So as you've all been doing, you're welcome to introduce yourselves in the chat box and talk about anything kind of informal in there. The session, as Sam said, is being recorded and it will be shared with all of you afterwards. Just to let you know, it is being recorded. There's going to be an opportunity to ask questions to all the panelists, to both the panelists after they've spoken. But in the meantime, if you're thinking of questions, you'll see we've got a Q&A box. So just add your questions throughout the session at any point, and then we'll pick them up at the end and relay them to the panelists. And I think in that box, other participants can upvote your questions. So if there's ones that you're particularly keen that you want to be answered, then do take a look at that and just upvote them. But we'll try and cover everything if we've got enough time. So just as a short introduction, Golden Key is a partnership between statutory services and commissioners in the voluntary sector and people with lived experience across Bristol. And we work together to improve services for Bristol's citizens with the most complex needs. So this session is going to be examining what we mean by and look at the value of reflective practice, the different forms it can take, its use in working with people with multiple disadvantage, and the ways in which it can improve culture, well-being, and staff mental health as well across the system. So I'm going to introduce you to our first panelist, I think. Michelle, you're first, aren't you? Yep. So Michelle Desmier is a clinical psychologist with Golden Key, and she works really closely with our service coordinator team as well as people across the partnership. Michelle, I think I'll pass over to you, and you've got a screen to share, haven't you?
Yeah, I will do that shortly. Okay, so welcome everyone, and thank you for coming along today. I think it's really nice to see so many people here interested in reflective practice. Particularly so early in the morning, so a warm welcome to you all. And I'm aware that everyone attending today is going to have different experiences with regards to reflective practice, and so hopefully by the end of the webinar and through your comments and questions, we can sort of form a bit of a shared understanding together of what reflective practice is and how it might be helpful for your context. So please do add your questions and comments in the question and answer box, and we'll come to those at the end. So reflective practice, what is it? We talk about it a lot, but it might all have a different understanding of what it is. It's something that's used in a variety of settings, and it's been used for a number of decades in education settings and health and social care in particular, but also business and design in criminal justice settings, and increasingly more common in services working with people with experiencing multiple disadvantage. There are lots of different definitions of reflective practice, but essentially it's learning from our experiences and developing a deeper understanding of our work in order to improve our practice. So it's a bit like thinking about what's the impact of us on our work, but also what's the impact of the work on us. And using that to inform how we work in different contexts. It involves taking time out to think about what we do, paying attention to our relationships, thoughts, assumptions, behaviours, actions, our physical and emotional responses, and that can be sort of in general or in particular situations. It includes analysing events and drawing on wider knowledge to make sense of our experiences and to work out what might be going on in particular situations. And that can help us to generate multiple perspectives. And for me, this is one of the key aims of reflective practice, is that we can, if we don't share our learning or our thoughts or our experiences, we can sort of end up working in the same way and maybe not see other ways of doing things, and we can lose our creativity in that sense. So sharing our practice with colleagues and other people helps to bring in that creativity and generate those multiple perspectives, which can help to inform our work going forward. Sometimes this can result in finding solutions to problems, but it certainly, solution finding isn't the focus of reflective practice. And quite often it's just about having a space to think and reflect and to hear other people's viewpoints on that. It can happen in a variety of different ways, such as individually, through journals, through conversations with managers and supervisors or peers, and more becoming more popular is reflecting in groups. So being with a group of colleagues and maybe having an internal or external facilitator. It can include reflective practice models and theories, but it doesn't have to. And there's no right or wrong way to do it. It can include reflecting on, amongst other things, aspects such as gender, age, ability, appearance, ethnicity, sexual orientation. So thinking about what is it from certain aspects that we bring into the room, and how does that influence how we view a situation or how we see other people. But regardless of the structure used, an essential aspect is that reflective practice feels non-judgmental and safe enough for people to take risks. And the risks are in sharing their practice and being willing to be a little bit vulnerable with colleagues and peers, so that they can learn from other people and from their own experiences. So if I can manage to do this, I haven't done a slide share thing for a while now, so I might need your help, Beth and Sam, if this doesn't work. So I just wanted to share one slide with you that for me helps me to remember or think about what reflective practice is. And if you think about the sort of the pressure cooker on the left, like we can have lots of common situations in our work where we might have multiple demands, we might be dealing with complex information or concerns about safety, or managing some situations where there are lots of intense emotions around, and it could all build up and become a bit of a pressure pot. And for me, reflective practice is like the image on the right. It's sort of taking some time to stop and have a pause and just sit back and think about what's going on. And we might do that by ourselves through a number of different processes, but for me, I find it particularly valuable in reflective practice being held in groups. And I suppose one of the other things to think about is how reflective practice can be preventative. That if we don't pay attention to the things that are building up in our pressure cooker and take some time to release that, then over a longer period of time, it can cause difficulties in our functioning and ability to think clearly, and over the longer term it can have more significant consequences. So if I work out how to stop sharing. Fab. So who can do reflective practice? Who can attend? And I think this is something for organisations to think about, because it depends on different contexts. But for culture change around reflective practice to occur, it needs to be happening at all levels. And this can include practitioners, volunteers, mentors, carers, people with lived experience who are sort of working as reps, estates and domestic staff, admin and reception staff, senior practitioners and managers and senior staff. So the groups can be mixed across different staff groups, or they can be sort of consist of peers with similar roles, and they can be across teams, within teams, and across organisations. So I think it really depends on what the purpose of the reflective practice is, and how everyone involved wants to have it set up. So what are the benefits? For staff, there's increased morale and well-being. It can help us to develop compassionate, safe and person-centred relationships with the people that we work with and our clients. And this is really important as clients, particularly when working with people experiencing multiple disadvantage, as clients have often experienced adversity and trauma and may find it difficult to trust people. So reflective practice can be a resource in helping us to think and be compassionate in our work, and particularly at times when things might be stressful. It helps us develop an ability to acknowledge, understand and work with emotions, so becoming more comfortable with uncomfortable feelings and uncomfortable conversations. It can help to our ability to problem solve and manage crisis, and it can help to build closer relationships with colleagues. And this is, I think, building closer relationships with colleagues is really important, and has been really important, particularly during the pandemic, because we know that where there's closer relationships with your team, it increases team resilience through difficult times. For clients, the research suggests that reflective practice where staff attend, it creates positive outcomes for clients, leads to better engagement between clients and staff, leads to fewer incidences and fewer evictions and tenancy abandonments. And for organisations, it can reduce staff absence, creates a more collaborative workplace culture, and facilitates professional development, amongst other things. But essentially, I think if we don't consider our assumptions about the world and about the clients, how where we might be going as individuals and in organisations, it's hard to see where we might be practicing in discriminative or oppressive ways, or where we're missing out on doing things more creatively. So in summary, there's no one definition of what reflective practice is. It can take different forms, can be relevant for people with a variety of roles, and research suggests that there are a number of benefits. So I hope that you found some of that information helpful. And if you have any questions, then please do add them into the Q&A box, and we'll respond to them shortly. And for now, I will hand you back to Beth to introduce the next section. Thank you for listening.
Brilliant. Thanks very much, Michelle. That was great. And I think that we're going to go straight to you, Ash. So this is Ashley Ward. You're the Reflective Practice Facilitator at 1625 Independent People. And yeah, straight over to you.
Thank you, Beth. Yeah. So I work at 1625 Independent People. We're a youth homelessness prevention service in Bristol. We work across the southwest, work across Bristol, Baines, South Gloss and North Somerset. And we have been running an internal reflective practice program for about 6 years now. And what that means is that all staff meet monthly for about an hour and a half with a mixed group of people. So there could be people who are, managers, with frontline staff, with people who work on reception, with maintenance staff. So people are meeting across teams for about an hour and a half, and to sit in a reflective group. And those reflective groups are facilitated by 2 members of staff from the organisation. So each group has two people. The groups are peer-led. And that program runs continuously every month. And so, as you might have guessed, reflective practice is something that we really do value and care about at 1625 Independent People. And we have a large group of staff who are the facilitators. So we have about 25 staff who are kind of actively facilitating at the moment, with a number of people who are trained but perhaps not facilitating. So yeah, reflective practice is a big part of the way that we do things. And so we've partnered with Golden Key to develop a training to support other organisations to do exactly the same. So the training comes in 2 parts, and I could just share a slide briefly just to talk about it. So not this slide. So yeah, I'll just talk about this briefly. So this is us. We work with around 2,500 young people every year. We've got around 120 staff. These are some of the areas that we work over. And this just summarises what I've got. I'll I'll share these slides with the group because there's quite a long slide pack that I'm not going to go through today. But if people are interested to know a bit more about our journey and how reflective practice works for us and a bit more about the training program, all of that is in here, and I can send that to Beth to send around to the group. So yeah, but I could just show you a bit about the training program, which is here. So the training program is broken up into 2 trainings. So the first training is about developing reflective practice within organizations. And that's facilitated by Michelle and Dawn Taylor. So Dawn Taylor is the operations director at 1625, and she's been kind of leading on the reflective practice implementation over the last 6 years. So yeah, the first training is 3 half days. Probably should get that right. Is that right, Michelle?
Yeah. Yeah, 3 oh, 2 half days, sorry, 2 half days. Yeah.
Perfect. Okay, so 2 half days on developing reflective practice, and so that training covers how, as an organization, one goes about implementing a kind of widespread reflective practice program. And that training is really designed for managers, operational people, strategic leads, the people who will be involved in the kind of logistics and setting up of the reflective practice program. And that covers these things over here. So, you know, what is reflective practice? What's the evidence base for it? And how could it help my particular context? It looks at a case study about, yeah, I think we focus on how Golden Key have embedded reflective practice and how 1625 have embedded reflective practice to slightly different contexts. We look at some of the outcomes from those organizations. And yeah, so it's about consideration. So what the role of the facilitator is, who would be appropriate, how to train those people, and some of the impacts, so the evidence for effective practice and how it contributes to organizational resilience. And then there's a separate training, which is a 4 half-day reflective practice facilitator skills training. And that's for those people who will actually be facilitating the reflective practice groups. So that training covers many of the, so that training pulls largely from psychotherapy and clinical psychology, the things that we know about group work and how groups function and kind of what's required to be an effective group facilitator. And in that training, there's lots of opportunities for kind of real experiential practice. We give people kind of models to work with and scenarios to play with. And it's a very kind of engaging and dynamic training experience. So those are the 2 trainings that we're offering. One for operational staff and one for those people within organizations who will actually be facilitating groups. What else could I say? Beth, how much longer is it helpful for me to speak for?
Well, we're running slightly ahead of time, so you've got 5-10 minutes actually, if you'd like it.
Yeah, okay. So what else could I say? I wanted to come with some feedback from the training, but we've been running this training since September last year. And we've run, I think, around 3 of the developing reflective practice trainings. We've run around 9 of the reflective practice facilitator skills training. We're actually going through the process of making sense of that feedback and adapting the training. So what if people are interested, I can send around some of that information when we've got more of a comprehensive feedback report. But I thought that I could share this slide, which is a reflective practice survey, an internal survey that we sent round to the staff of 1625 independent people to get an understanding of how reflective practice is going within the organisation. And these are just some of the comments and the stats from that. So 96% of frontline staff said that reflective practice helps to improve their understanding of the young people that they work with. 91% of staff stated that their facilitator shows effective group leadership. And so those people, those facilitators, will have participated in the training or a very similar training to the one that Michelle, Tom and I are delivering at the moment. And 91% of all staff state that reflective practice supports the emotional challenge of working with complexity. So you know, like Michelle was saying, reflective practice is a really effective tool for organizations who are doing work that happens kind of in the moment, where there isn't a lot of opportunity to kind of reflect as you're working, and you might be working with you know, complex needs or situations that are challenging in some way. So yeah, and here are some kind of interesting pieces of feedback. So someone said it helps me to consider alternative perspectives, ones that I might not have thought about previously. Someone said here the staff can be great at thinking outside of the box to approach a problem. So reflective practice is a real opportunity to think creatively about stuff, just like Michelle was saying. What does this say? Usually we spend most of the session discussing cases, about 85%. However, my group is flexible enough, and if we want to talk about something else other than cases, it is welcomed. Yeah, so reflective practice can be a real powerful opportunity to kind of bring in the whole person or someone's experience from outside of the kind of casework they're doing. That no doubt has an impact on their the way that they operate in the organization. So when I was most of the reflective practice groups that I attended over the summer last year, people were talking, of course, about the impact of the pandemic and the impact of the Black Lives Matter protests. So, you know, reflective practice is an opportunity to think about the wider context, the social and political context, and bring that into how that's impacting people. Yeah, and this person said, I find RP most valuable as a broader reflective tool around the culture and practice of the organization. I do find reflective practice extremely valuable. I think reflection is an important part of learning and developing in general. So reflective practice can really work as a forum to think about the culture of the organization and the organization's practices, and yeah, come up with creative ways of shifting that. And it gives people a sense of autonomy, I think, and really brings people back to being a contributing person in the organization. Yeah, I mean, certainly that's what we've seen at 1625. A huge amount of organizational learning comes out of the groups and is fed back into the organization and helps kind of shift the direction of things. So yeah, what else is useful? These are some snippets of feedback from the training program. So this is from these are participant comments from the training that Michelle, Tom and I have been running. I don't need to read out all of these, but I'll leave them on screen. And I think they really speak to the training. We've tried to create a space that is really safe and welcoming and allows people to kind of reach a place of really understanding who they are in a group setting and kind of what group work is about. So, and you know, that's been our intention from the start, that the training operates as a forum that allows people to kind of model what group work is like. And I think some of these comments speak to that. So yeah, I'll probably leave it there. Is that okay, Beth?
Yeah, that's great. Thank you very much, Ashley. That's brilliant. So I think it would be good to move on to some questions. We've had some come up since you've been talking, Ashley. I think that maybe we'll come to John's first, just because it's kind of relevant to what you were talking about, and he actually said you partly answered his question. But can you see the question? Shall I read it out to you?
Yeah, you could read it out.
I'll read it out so that everyone can. So John said, hi, Ashley. Do you think your high levels of connection with RP is due to the organisation being psychologically informed and demonstrating PI principles? There's three questions, actually. How do organisations that are not psychologically informed move to this position? And the culture will determine the ability to make RP happen, potentially, as a question.
Yeah, absolutely.
Are you happy to?
Yeah. So I do think that the engagement with RP is because the organisation does operate on PI principles, and we recruit on PI principles as well. So in people's job descriptions and job applications, we ask people to demonstrate some kind of commitment to a psychologically informed environment. And I guess over time, that means that the organization is made up of people who are kind of already engaged or have an interest in this way of working. So yes, there is a relationship there. And so the question, how do organizations that are not so psychologically informed move to this position? Well, I think the first training, the developing RP training that Michelle and Dawn run, starts to support that culture shift and starts to think about some of the wider organizational principles that are involved in embedding RP effectively. I also think it's not easy. I think it's been quite a journey at 1625 to, over the years, to kind of spread the message. This is the way that we do things, and reflective practice is a fundamental part of the way things operate. And it's not, everyone's busy, and people often have lots of team forums, team meetings, clinical supervision, group supervision. Or, there are different ways of reflecting on one's work, and so it's not always obvious to people why they need another group reflective practice in order to support that kind of way of working. And so it does take a bit of time and a bit of experience in reflective practice groups for people to really get the value and understand that, yes, this is something valuable and this is the way that we want to work, and to kind of drive a bit of enthusiasm for the process. But I think persistence is important, sticking with it, giving people lots of opportunities to attend. I think all of those things can kind of shift the culture. It does take time. And so John's final question was, the culture will determine the ability to make RP happen. So in my previous answer, I guess what I'm saying is that also just having reflective practice does shift the culture as well. But both support each other. Having a particular culture supports RP, and RP could support a particular culture forming.
Yeah, and that's actually something that Michelle touched on when you were talking earlier as well. I kind of made note of. Thanks, Ashley. I was just wondering if you wanted to say any more about it, Michelle, and actually I might combine it with a couple of comments that Helena's made. So Helena said that she'd like to be part of this initiative with her teams, and also she's asking, did you do any prep work with the teams before introducing RP? So yeah, would you be happy to respond a bit more, Mish, to a couple of those things? You're muted just now.
I'll unmute myself. I suppose this relates to what Ash was saying as well. In the setting up of reflective practice is really important, and what I tend to do is meet a couple of times with managers and senior practitioners and team members as well to find out what it is that they're looking for. I think one of the challenges can be when people don't know what reflective practice is. So they don't know why they're coming to a group, or some people might be worried that it's a bit like a group therapy session and they're going to expect to talk about all their personal life. Other people might have a sense of this is supervision and all the problems are going to be solved. So it's really important that people have a shared understanding, and that understanding across the organisation is shared around the purpose of reflective practice. So what is it we're going to be doing? Why do we want to do it? And what are we looking for the benefits? I think the other part in those conversations is around transparency and group ownership. So for people to feel involved in the decision making around it, around how reflective practice might look in their organisation, and I think that helps with sort of commitment to people attending. If it feels like it's something that's come from above, like this is reflective practice, you will go, it makes it harder for people to commit to it if it's something that they don't feel involved in. So I think those conversations are really important, and I think sharing the benefits, and for organisations to show, actually, one of the reasons why we want to do this is because there are benefits for staff and for clients and organisations, and part of that comes from showing that we care about the staff that we work with, and that actually we recognise that people do an often difficult and challenging as well as rewarding role, and just wanting to create those spaces for people so that they can feel heard and supported and develop their skills. I think something that's interesting around the context that you're going into with reflective practice. So I work across sort of third sector organisations and NHS organisations, and in organisations where there is a mix of the two. And I think the culture beforehand can be very different depending on the manager and the team, the staff team who are there, and how colleagues get on and how much they're committed to sort of psychological approaches. But I've also worked in the emergency accommodation team that was set up during COVID for people who are homeless or vulnerably housed, and that was a combination of hotel staff, staff working for Golden Key in a support and coordination role, and security staff, and everyone was invited to attend and came with different ideas of what reflective practice is. Some people had never heard of reflective practice. They wouldn't have necessarily known what a psychologically informed environment was, or had sort of knowledge in how to do that. But interestingly, I think what people bring with them is their own ethics and culture within themselves. And so in some ways, those frameworks weren't essential, because people just were willing to be curious and to give reflective practice a go, and to see what the benefits are, or recognise actually getting together as a group of people, like working in the same environment, can be helpful. So I think, yeah, there's lots of factors that go into thinking about and setting up reflective practice, and I think the preparation side of things is really important.
Brilliant, thanks very much, Michelle. And I think I'm going to go next to Aileen's comment. So I think this is probably more for you, Ashley, but either of you, great to hear from you. Aileen said, great to hear about the 1625 independent people approach. Could you talk about different approaches and when to use peer facilitators, or when to use psychologists to facilitate?
Yeah, so Michelle might have some views on this as well, being a psychologist, but also being in an organisation where peers facilitate. But I guess from our perspective, the reason that we value peer facilitation, it's not to say that we don't value psychologists, because lots of our teams do have clinical supervision or will do other group work with a psychologist. But the peer facilitation, it leads to a kind of, we believe, a leveling of the hierarchy, and that allows people to, that just shifts the group dynamic in a certain way, and it allows people to maybe the sense of safety and trust in the group develops very quickly, because you're working with people who are kind of who who you've worked with, who are part of the same organization, who understand the organization's culture and context. When we bring in external psychologists, it turns it into a bit more of a psychological space, and that's not really the intention of reflective practice. It's the intention at 1625 is for the group to support the person or people sharing to kind of come to an understanding of whatever it is they want to, whatever they're trying to solve, and to use the resources of the group to help them get there. It's not intended, like Michelle was saying, to be a therapeutic space. Yeah, so that's why we value peer facilitation. Michelle, I wonder if you could speak to the difference as you see it.
I think there might be a difference between internal and external psychologists facilitating. So where psychologists are part of the team or work closely with teams, they might have a better understanding of the work that people are involved in. I would suggest there's probably pros and cons to both approaches, that having, like Ash was saying, like there could be an element of that hierarchy being there, which might make it difficult for people to feel more able to speak about their work, particularly initially. But I think also that there's a real value in developing staff skills to facilitate reflective practice. And I think, as Ash was saying, there's something about seeing a peer in a similar role, really being committed to it by becoming a facilitator and hosting a group helps to shift some of the culture. So yeah, so I think there's advantages and disadvantages to having somebody internal in the team and to having somebody external in the team. And I suppose one of the advantages of having somebody external is that everyone in that team can then be in reflective practice together and share their experiences rather than one person picking up a facilitative role. But I think, yeah, in sort of choosing what approach to go forward with, again, I would say talk to the people involved and see what they want to do, whether they would prefer to have peer facilitation, whether they would prefer to have a psychologist, whether they want somebody within their team facilitating, somebody external from their team. So there are all the sorts of questions that are involved in the setting things up at the beginning.
Brilliant, thanks very much, both of you. So we're going to move on to Jess's question, and she's first of all said, great session, thank you everyone. And then she's asked, is there a recommended regularity for reflective sessions? I'm assuming that somewhere between once a week to once a month, perhaps depending on different teams, is her comment. Who would like to take that first?
I don't mind. And Jess, it sounds like you've answered that yourself, that question.
Yeah,
and it is absolutely depending on the team. In some of the groups that I facilitate, we meet monthly for an hour and a half. In other groups, we meet how often do we meet? Fortnightly for an hour. But I think it really just depends on people's needs and I guess their own journey. Sometimes people might want to meet more frequently at the start of reflective practice so that to get it more embedded and get the sense of it, and then can change to less frequently. So I think there's nothing set in stone around it. I would say the only thing, I suppose the only thing that I would really sort of say is important is a minimum of an hour. And that's because it can be very sort of difficult conversations that come up, and just needing to have a space where people feel safe and having the time to do that. But how often that hour is depends on the people involved.
Thanks, Michelle. I'm just going to briefly bring in Helena's comment that she's just added, because it's related to what you were talking about earlier, and follow it up with a question that I've got. Helena's saying that people can facilitate with other teams so that people don't feel intimidated by their own colleague, which is one of the options you were talking about. But also earlier in your presentation, Michelle, you were talking about creating compassionate and safe working relationships, and that being one of the purposes of reflective practice. And you talked about people taking risks, and I wondered what are the biggest challenges for that, and can that sometimes be related to who's facilitating? Whether you want to talk about those risks a bit more.
Yeah, I think it can be related to who's facilitating and also how it's set up. So the risks are people sort of sharing their practice maybe in a different way to how they might do more generally in their work. So being willing to be vulnerable and talk about, oh, there was a situation and I didn't know what I was doing, or this happened and my mind went blank, or I don't think I handled it very well, and I wish I'd said something differently. So those sorts of situations that we might not always share with our colleagues, reflective practice encourages people to bring those so that we can explore them and think about, well, what might be going on there for you? What might be going on there for other people involved? How do we make sense of this situation? and thinking about, is there anything that people want to take forward into their practice, and are there any other perspectives? So I think there's the risk is around sharing practice in a different way if it's something that's unfamiliar, that people aren't used to. The challenges for whoever's facilitating, whether that's a peer facilitator or somebody else, to create an environment that feels non-judgmental and safe enough for people to take those risks, and for the group to develop trust amongst them. And it might be that we trust our colleagues outside of reflective practice, but there's a process that people might need to go through to build that trust within the group once it starts.
Thanks very much, Michelle.
Ash,
go on.
Yeah, just reflective practice groups have a particular kind of framing that differs, that separates them from other groups, but at the same time we are just practicing group work, and many of the skills that facilitators use and hopefully other people in the group use are the same skills that one uses in all kinds of groups that they're part of. So reflective practice is an incredible opportunity for people who are involved in helping work or relational kind of work to actually practice the same skills that they will use with the people that they work with, whether it's kind of just in an organization or you work with clients or service users in a kind of frontline context. Reflective practice is a kind of training forum in a way for one to practice the same skills that they'll use and to kind of model and watch other people using these skills really effectively, and hopefully be inspired by their facilitator, who should hopefully be someone who kind of brings some of these skills to the fore. So yeah, I just wanted to kind of add that reflective practice actually functions as an opportunity to practice and model and train the same kind of relational skills that I think we hope people will use in their jobs day to day.
Thanks to both of you. We're going to go on to Jason's comment at the top, which in a way is a little bit linked to that. Jason saying, what value is placed on self-reflection because work experience crosses and pollinates into individuals' life experiences? Black Lives Matter being a great example.
Yeah. In the approach that we are sharing in the training, a huge amount of value is placed on self-reflection. But I think just touching into what Michelle was saying earlier, like that doesn't always happen straight away. And being able to get to a point where you can kind of authentically reflect on yourself in a group setting with people that you work with is incredibly powerful, but it takes time, and it takes time for the kind of sense of safety and trust to develop in a group where people are able to get to that point. These are things that we touch on the training, you know, how to kind of cultivate that atmosphere, how to allow time to pass, some of the things that you might see over time in groups. But yeah, definitely a huge value is placed on self-reflection, certainly in the approach that we're offering. And yeah, you know, we're also inviting people to try to bring in as much of their whole self as possible. So that will vary. Different people feel kind of more or less comfortable bringing in their whole self. But yeah, it's definitely something that we advocate. We advocate people thinking about the wider context in which they live, the organizational context, the social context, the political context, and being willing to kind of navigate these spaces and bring in as much of that stuff into the group. And I think it's for that reason that reflective practice is quite unique. You know, it differs from some of the other forums that you might have in organizations which have a particular agenda. You know, it might just be focused on casework or on teamwork or something like that. But reflective practice is that forum where hopefully more and more of these other factors can be brought in, and people can start to develop a real sense of awareness about where they are in their work and in their life. But yeah, it definitely takes time. It isn't easy. And yeah, it requires a bit of support from the facilitator to get there. I hope that's answered that question.
Thanks, Ashley. Do you have anything to add, Michelle?
Just, I suppose, one of the the aims of reflective practice is to take what happens in the group setting to our individual practice. And Donald Sean, who's credited with developing the concept of reflective practice, he talked about reflection in action and reflection on action. And reflection in action is when we're in the moment and we've got that space to be able to think about, okay, what am I about to say here, or what might be a useful way to respond in this situation, or what might be going on here. And I think through attending reflective practice groups and exploring those wider social and political contexts, we can then sort of work our way to being able to think about that in the moment, and thinking about, you know, conversations like, oh, hang on a minute, I'm coming from the perspective of a female in a position of authority, and how might that people might be experiencing that. What do I need to do to change how I am in this situation? And he also talked about reflection on action, so after the moment, so thinking about what happened in that situation, what is it that I brought to it that might have influenced that situation, and viewed, you know, what was going on. So I think there's a constant cycle between that sort of what we learn in the group and how we bring that into our individual practice. But as Ash was saying, depending on people's backgrounds and previous experiences, it might happen naturally for some people, but for others it might take more time to develop.
Thanks, Michelle. I'm just aware we've got 10 minutes left. I just want to kind of add Helena's comment that I think she made relating to that last question. She's saying it's about self-regulating emotions and resilience, and to know when we need debriefing and peer support. It wasn't a question so much as I think she just wanted to comment that. Okay, so we've got I think 3 more questions, 10 minutes. So Maxine has said, in my organisation, we have around 40 staff and 150 active volunteers. How many people would you recommend to be trained in facilitating RP, assuming that we would like the majority to get involved in reflective practice sessions? I'm aware we have several trained already here, but I'm keen to have more, myself included.
I as feasible, and part of that is it can help to share the culture and commitment of reflective practice, but I think also to manage sort of staff changes, like people leave roles and move on to something different, and having enough staff to be able to step in can be really helpful. I think also thinking about how many people you want to facilitate each group. If you're aiming for 2 facilitators, needing to make sure that you've got enough people to be able to cover that as well. And I think, yeah, I think as a personal development opportunity for people who are interested, it can be really helpful. So when we're sort of looking at who needs to go on training, we'll put it out to the team and see who's interested in attending, and try and get as many of our team trained in facilitating reflective practice as possible. And if they're not going on to deliver reflective practice themselves, I think it can be really helpful to get a deeper understanding of what's involved and how it might work and what the benefits are. I don't know, Ash, if you've got anything to add to that, because you've got.
I definitely agree. As many people as possible for that reason, because there can be a lot of churn and it's good to get people to step in. I think if you've got 40 staff and 100, well, whatever the numbers are, I think having 2 people per group, if it's peer facilitated, is generally the way to go. They can support each other in that process. So if you've got 2 people who can step into every group, that would be ideal. Yeah.
Okay, thanks very much.
Can I just
yes.
come back to I think it was Helena who raised the point earlier about if you are using peer facilitators, just the ideal would be that people would facilitate outside of their group, but in smaller organizations sometimes that's not possible, so it can be helpful to have that flexibility to facilitate within a group, but again, sort of negotiating with your colleagues about who might be best placed to do that and how that might work.
Yeah, that absolutely makes sense. It's contextual, isn't it? Mm. Okay, so Aileen is asking, is there anything that you would do differently given what you've learned? So it's a question for both of you, really.
Yeah, so I'm going to answer this really roundabout way, which is to say that we are constantly evaluating the reflective practice program at 1625, that, you know, so sending out surveys to staff and to facilitators, and getting the facilitator group together to talk about how things are going, where the blocks are or the challenges. And so through that process of constantly evaluating, stuff changes, and the stuff that changes it's like, you know, the makeup of the groups, who's in the groups, how frequently they run, do we need more groups or less, you know, what are people valuing or not. So there is so much that changes. In fact, like, I've got a meeting later this week with the whole facilitator group where we're going to talk about how we manage attendance within the groups to support people to come to groups, but without making facilitators feel that they're kind of checking people off on a list, and just to kind of figure that out. So there's stuff that's always changing, and a big part of embedding a reflective practice program is that process of evaluating. So because it's never just going to kind of be set up and run off the bat. It will be something that, you know, doesn't work to begin with and needs fixing and needs adjusting, and, you know, people's experiences and your particular context, all of that stuff feeds into how the program operates. So yeah, there's you know, over the years there's been a constant iteration, so there's actually lots that is done and is being done differently year to year or month to month, and on the training, lots of these different aspects are discussed, both on the development training and on the facilitator skills training. We talk about different different areas of focus and what that might look like for your particular context. So I'm sorry that's like a really kind of it depends kind of answer, but yeah, there's so much that changes.
Michelle, what about you? Any further thoughts on that?
I'd agree with Ash with lots of that. I think with Golden Key and with my NHS groups as well, and combined groups, it's been a constant journey. Sometimes it's to do with staff changes, sometimes it's to do with expansion or reduction in teams, that things need to be done differently, or sometimes it can be to do with, so in a lot of the Golden Key groups, I started off facilitating reflective practice first, but then as people's confidence grew and they became more interested in reflective practice, we created opportunities for people to do the training and take on roles themselves. So I think there's constant change and reflection and learning from what's going on. I think for my early days of reflective practice, I think as a facilitator, I think one of the changes would be to, one thing I would have done differently is checked about minimum attendance. So checking with the group, what's the minimum number of people that we would run a group with. So I've spent sometimes in rooms with nobody attending, and often that can be a helpful thing as well. Like sitting in a room and just letting people know that you were there, even if no one turned up, can just be part of that sort of engagement process with RP. But I think, thinking about when groups work and when groups don't work, and what's the minimum number that we're going to keep going with it, depending on attendance, and thinking about, what are the parameters around going with a group and not going with a group, because sometimes actually it's not possible. It's not the structure and the supports aren't in place for a reflective practice group to run, and I think the thing I would have done differently is being clearer about that at the beginning with organisations and people involved.
Okay. Thank you both very much. We've got to start wrapping it up now, but I just want to very briefly go to Jason's comment. Maybe you could give me 30 seconds on it. He's asked about confidentiality and closed or open groups.
Who's going to talk quicker?
Yeah.
I could say something very quickly. So groups are generally better when they're confidential. That helps the sense of safety and trust in the group to develop. But obviously, you know, in a kind of service context, there are limits to confidentiality, which might be around safeguarding. There might be a responsibility for the facilitator to communicate something outside of the group if a safeguarding issue kind of arises. But you know, I think that can be communicated to the group effectively, that the group is confidential, but here are the boundaries around, you know, where that confidentiality has to break. Most people tend to understand that. So yeah, trying to keep the group as confidential as possible is definitely what I would recommend. Michelle, do you have any views on closed or open?
I think again, it's something to negotiate with the people who are going to be attending and seeing what works for them. And I think something that sort of sits between in the middle is where there's shift patterns involved. So sometimes you might be in a group with somebody, but you might not see them again in that group for another couple of months, depending on where your shift patterns lie. So thinking about if it's not going to be the same people each time, how does a group want to think about creating that sense of safety and trust and connectedness with maybe people who aren't there?
Brilliant. Thank you both. We've got more questions coming in, but I think we've got to end now. I'm really sorry, Alison, we're not going to get to that question. Do get in contact with us directly if you want to follow us up with the records question. So thank you all so much for coming. I do want to address Tamara's question anyway. Can you share when you're next delivering training sessions?
Yeah.
Ash, do you want to take that?
Yeah, we're running. So we're actually running one at the moment. So that's in process. So the dates for the next one haven't been decided, but I think we're looking at September, and we can email the group. We've got everyone's contacts, I guess, through Beth, and we can just share when we've got the dates. Yeah, the date's ready. Brilliant.
Thank you very much. So I think that is everything. Yeah, it's been fantastic that so many of you have come along, and do leave final comments in the chat box if you'd like to. Thank you, Michelle and Ashley, for everything. It's been really great to hear your thoughts on reflective practice, and also thanks to Golden Key for hosting. Okay, that's us. Back to you, Sam.
Thanks, everyone.
I mean, what can I add to that? Thank you. What an excellent session that was. Thank you so much. And yes, if anyone has any comments or feedback for us, please do leave them in the Q&A box. And our next system leadership webinar will probably be in the next couple of months. But thank you so much, everybody. Again, thank you to all our awesome panelists, and for Beth for being brilliant. And have a fantastic rest of your morning, everybody. Take care. Bye-bye.